Welcome to Partnership Live, our monthly discussion with leaders in healthcare who are shaping New Jersey. I'm Mariekarl Vilceus-Talty, and I'm so happy. Today, we are welcomed by Ms. Linda Sloan Locke, certified nurse midwife, social worker, consultant, advocate. I can go on and on and on and on, right, Linda? I'm so happy to have you here with us today. How are you?
I'm good. Thank you so much for having me, Mariekarl.
Absolutely. Linda, we were just talking before. You do so much. I cannot imagine you doing anything else. But if you were not in this field right now, being midwife, being a social worker, being an advocate, what would you be doing?
Well, my goal really was to be a pilot.
Oh.
And I would be flying. That's actually what I would be doing if I wasn't in healthcare, although there is a mandatory requirement for piloting on the commercial level. I would still be able to, do private piloting. So if I wasn't in healthcare, I would be flying a plane.
Oh, very, very nice. Any reason why? What got you to?
My dad was a Tuskegee Airman. And my introduction to flight was him taking me up in a Cessna, which is the plane that I fly when I do fly. I haven't been able to fly in several years now, but that was my introduction to flight. I just feel like it's in my bones. I love the feeling of being up in the air and away from, the everyday carrying someone on the ground. So yeah, that would be my choice.
That is really amazing history there. But in a way, you are still in the pilot seat driving, being a midwife and a social worker. And I know we just finished Women's Health Month, but there's sometimes some confusion about midwifery and doulas and so on and so forth. So can you describe the roles that midwives play in improving healthcare and, most importantly, healthcare outcomes in women's health?
Yes, I would be happy to. So midwives are healthcare providers. We provide healthcare for women and people who were born biologically women, regardless of how they identify throughout the lifespan. And the word midwife comes from the Old English, and mid means to be with woman. So that's, and we are really the oldest profession. You can see pictures of midwives delivering babies in Egypt. There's the midwives in the Bible, there's the midwives in other, ancient literature. So we know that midwives have been really the only respected profession for women throughout time. And so today's midwife is a healthcare provider, and in New Jersey, we are licensed as midwives to provide healthcare to women. And although we are certainly known for our attention to birth and labor and pregnancy, we do provide healthcare for women throughout the life cycle. So we say that we take care of you from menarche, from when you have your first period, through and after menopause. So we really take care of you throughout the life cycle and provide not only reproductive health care, but primary health care as well. And we really it's been demonstrated that midwifery care is the kind of care that has very good outcomes. When we take care of people, there are lower rates of cesarean section and the complications that often accompany that. There are higher rates of vaginal delivery after previous cesarean section, or VBAC as it's known. We have higher rates of breastfeeding for those women who desire to breastfeed, or persons who desire to breast or chest feed and are cared for by a midwife. They're more likely to be successful. And lower rates of preterm birth as well. So there are many kind of benchmarks for identifying health outcomes that midwifery care has shown to really improve those benchmarks for care.
And that is really important to highlight those outcomes because, as we discussed, there's always some type of confusion about, oh, can my midwife do this? Can my midwife do that? And to underline, you can go to a midwife for complete primary care. You do
Yes,
not have to go to an OBGYN. And that is
yeah.
so very important because so many women are looking for other practitioners that look like them and that are women that identify as women that they feel comfortable with for that care from menarche to menopause. So really important. But can you describe the midwifery model and how is that different and unique?
Like the midwifery model of care is a model of care that is person-centered.
Mm-hmm.
We really have had, we are partners with women in their healthcare. And we've been saying that for decades. We're partners with women in their healthcare. We listen to women. So we've been partnering with women long before the shared decision-making model was introduced, because that is a basic tenet of midwifery care.
Mm-hmm.
We are person-centered. We respect people and women that we take care of. And we really respect and support the physiologic processes. We know how to intervene if necessary, but we don't intervene for the sake of intervention. We
Mm-hmm.
only intervene if it's necessary. So we use technology, but not just for the sake of using technology, but only when it's necessary. And support, and so by centering the person in our care and respecting that person and their wishes and desires, and really being the expert in natural and normal and physiologic processes, we really can deliver the kind of care that is not only very high quality care, but is also effective and cost effective. Mm-hmm. Because we do not have interventions just for intervention's sake. Mm-hmm. It's a very individualized approach. It's comprehensive and really focuses on preventative aspects and really try to deliver health care, not just illness care.
Right, right. And this is something, like you said, that has been here for millennia. So when we talk about the history of midwifery, can you go back and talk about the midwifery history within the United States? Because we know that throughout the world, women have been, there for other women, being able to assist them giving birth. But within the United States, talking about the grand midwives and the granny midwives, how does that really impact what you do?
So yeah, in the United States, I think what's important to note is that enslaved women who were midwives brought those skills with them when they were brought to the United States, as well as immigrant women. And of course, there were already indigenous midwives here when we came to, when the United States was colonized. But the enslaved women really played a huge role in much of the country, because they not only took care of other enslaved people who were for their reproductive health, but their enslavers as well. And so they were really the primary providers of reproductive health care for women in a large part of our country. Then what happened was that there was this medicalization of birth that began around the 1900s, and the idea into the 1900s of nurse midwifery, which I'm a nurse midwife, and I do adhere to, acknowledge that that's a really important way to be prepared, but it's not the only way to be prepared. Mm-hmm. And at that time, it was difficult because they really, in this medicalization of birth, cut out the midwives and really did not give them credit for the very good work that they had done and were continuing to do, and really tried to discredit midwives. And instead of we call them the grand midwives, but the term that was utilized by physicians at that time was granny midwives, and it was really a way of derogatory, right? And so we have taken that back and said, no, they were the grand midwives, and really to show their strength and their value. Mm-hmm. And so at that time, we know that there was a lot of discrimination. Black women were not admitted to nursing schools. And this continued well into the late 1900s, into the 1950s and 1960s. And even into the 1970s, and even we see today when we look at the numbers of people and the representation that BIPOC people have within the profession. Part of that's related to this very concerted effort And it was really basically racist and sexist, right? So these were Black women. And so they were really disparaged and looked down upon. And they the physicians at that time said, well, they didn't look upon pregnancy. They needed for pregnancy to become an illness if the physician was going to be the one to take care of pregnant people. So they really medicalized pregnancy and medicalized birth, brought it into the hospital, and really in a system in which those Black midwives would not be able to come in with their patients. The patients weren't even allowed into many of the hospitals at that time. So I think that what that has done is, as we look back on that history and the rich history that we really have for Black midwives in this country, it gives us a kind of renewed strength and a renewed commitment. It's something that is really a calling, and we feel like we are really honoring our ancestors when we do this work.
Absolutely. I want to go back to the different types of midwife. You said that you are a certified nurse midwife, but I know that there are some other distinctions that need to be made also. Can you share with us some of that information?
Sure. Most of the midwives in this country are certified nurse midwives. That's the British model, in which you become a midwife, a nurse first, and then do midwifery as either part of your nursing education or after nursing education. So CNMs in the United States are educated at the graduate level, either master's or doctorate degree, so that's either 2 to 3 to 4 years post-baccalaureate for a midwifery education. And to be a certified nurse midwife, you have to have the nursing degree prior to being admitted to that program. There's also the CM, which is a certified midwife, who is trained in the exact same program as CNMs without having a prior nursing degree. So that person may have a degree. We have some people that have actually come from other countries and have been physicians in their countries and decided to be a CM rather than going through to be a physician here in the United States. We have people who are physical therapists who have some kind of science background. They have a certain amount of prerequisites that they need to meet, and then they continue in the same course of study as certified nurse midwives. So we all go through the same education. We sit the same national board exam. There are also certified professional midwives who are educated in one of two ways. There are many educational programs. Some are at the baccalaureate level. Some are certificate programs around the country. Their training is focused only on pregnancy and birth. So whereas CNMs and CMs take care of women throughout the life cycle, PPMs focus on pregnancy and birth, and birth in the community. That means birth in home or birth center. And so those are the three types of midwives that are all licensed in New Jersey.
Okay, that's very, very interesting. Thank you very much for that. So when we're talking about the different types of midwives, now we have to come down and talk about the diversity in midwifery. So we know if I am looking for a Black midwife specifically, there are very few. And when we, start segmenting, looking for BIPOC population and, attempting to have a midwife from the BIPOC population to serve them, it's very, very difficult to find. So what is the impact of not having the diversity of midwifery and midwives specifically within our communities? What is that doing to our population in our community, in our experience?
Well, I think it's unfortunate because we know that we very often feel more comfortable with people who look like us and people who have a shared experience, right? And it is a problem that we recognize in our profession and are doing the best we can. We just elected our first Black president of ACNM, the American College of Nurse Midwives. We're really trying to move forward in getting more people of color to come into midwifery. We've been talking to many people about pipeline issues in healthcare, because midwifery is not the only profession in which we're lacking in representation, right? And in fact, the numbers of Black physicians is lower than it was, 20 years ago.
Mm-hmm.
So I think that there's pipeline issues around all health and healthcare professions that we really need to address. We are the midwives of color in the FACNM makes a lot of efforts to talk to high school students. And part of the problem, I think, with midwifery is a lot of people don't know what a midwife is, what a midwife does. And so how can you aspire to a profession if you're not familiar with what that profession is? Mm-hmm. Myself, I didn't know what a midwife was until I got into college. Mm-hmm. Just getting out more information to our communities, letting women and people of color know that this is a wonderful profession, that it has it's very rewarding, and that it can be so impactful to be in this profession. Then, along with that, having the support and the encouragement, we have programs where we have mentors and we partner midwives of color with student midwives of color to really help them through the process, because many of them find during the educational process many barriers that to being successful. Mm-hmm. And so we have programs like that to continue to uplift the numbers of BIPOC people in our profession.
Excellent. So for people watching now, if we were looking for a BIPOC midwife, what would we do? Where would we go? Is there somewhere that you log on? Is there an association? How can you guide us?
So I think it's not that easy to identify who is a person of color. You can go on the FACNM website, midwife.org, and click on Find a Midwife, and then you put your zip code in. It's like any other search tool, right? And you put your zip code in and you can find a midwife.
And like every other person, interview them, right?
Right. And then sometimes you can go on their website and see their pictures, right? And that'll let you know who they are.
Right.
That's a lot of practices do have, some kind of websites or identifiers, so you can go and see who you're going to be talking to, who is in that practice, what that person looks like, how that person identifies. Right. And then absolutely, I say for any healthcare provider, you should interview them.
Right. Regardless if you're looking for a BIPOC practitioner or not.
Absolutely, because you want to make sure when you go to a practitioner that this is a person with whom you are in sync, right? Mm-hmm. And that's really important, so that you can feel comfortable in your healthcare.
Yeah, absolutely. It is just so important. I would love to keep talking to you about midwifery and everything that the midwives do and how they are really changing the experience and the outcomes of the population. But in the beginning, I said that you're a midwife, certified nurse midwife, and a social worker, and a social justice advocate. And I'd like to switch to the social working part. So can you tell me a little bit more about what you're doing as a social worker?
Well, I became a social worker later in my career because I realized that I wasn't forever going to be able to get up at 2:00 in the morning and catch babies, right? I mean, eventually the back gives out and you have to say, okay, that's enough. And I wanted to continue to work with people and help people and, be part of a helping and caring professional. I started on the social work track because when I had my own practice, I found that annual exams took about a half an hour because people were really sharing with me so much of their life experience. And I really wanted to be better prepared to help them through the issues that they were having in their lives. And about my second year working on my MSW, I came across a quote that said, "The social worker is the midwife to the soul."
Oh.
And I felt that was really, it's really true. Because as midwives, we help people give birth to their children. As social workers, we help people give birth to themselves. And we know that mental health and physical health are so closely linked. There is no health without mental health. And of course, we're just finishing up Mental Health Month as well as Women's Health Month, which I think it's really important. It's really great that those are in the same month, right? Because they're so linked. And so that's why I really have felt that it was very, there was a lot of synchrony between midwifery and social work. They're very synchronous in that they both help people. We don't direct people what to do. We assist people in finding their way through what they need to get through. So that's been really, I think, helpful to me in social work and in providing counseling and therapy to people. I've done that. I started off before I was a midwife as a public health nurse. So my last social work job before the pandemic was as an in-home therapist. So I felt like I'd really kind of come full circle.
Yeah, you've come full circle. And one of the things that you also started to help people through their mental and emotional strifes is the New Jersey Health Cares about domestic and sexual violence collaboration.
Yeah,
that's share a bit about that.
Yeah, it's a project that's really close to my heart. When I was working on my MSW and I'm trying to figure out exactly what area I want to specialize in, and I really began to understand, and looking back on many of the experiences I'd had as a midwife and taking care of people that had experienced different kinds of trauma and how that trauma impacted their health and their ability to get through pregnancy and birth, looking at both domestic violence, interpersonal violence, and sexual trauma, and how they intersected so importantly with health. I got a certificate in violence against women and children when I got my MSW at Rutgers. And then when I finished the program and began talking to other practitioners about these intersections, I realized that many of us don't have a lot of preparation about that piece. We may get some information about domestic violence, and we may get some information about sexual violence, but really bringing those two together and helping healthcare professionals understand the significant impact of this type of trauma on health and how it shows up in the way people interact with us and in the health outcomes. So the collaborative's role is to share this information with healthcare providers, stress with them how important this is, how we know how prevalent trauma of all different types is, and how these different kinds of trauma show up every day in our patients' lives, and how we can recognize that and help them cope with that and really go through beyond trauma-informed care to healing.
Absolutely. I can't believe that we only have half an hour because there's so much more that we can talk about. But we started the beginning saying that, you're nurse, social worker, advocate, consultant, so much more that you're doing. Is there anything that you can share with us very quickly of your next steps of what you're doing? What do you have on the slate for tomorrow?
Tomorrow, I'm coming to your spring soiree.
Of course, the soiree, always a supporter. Thank you so very much.
That's going to be the highlight of my day tomorrow. But something people might not know, I have 10 grandchildren, and in about, I think, November, I'm going to have a great grandchild.
Oh my goodness.
So that is, when you say, what am I planning? I'm planning on being able to spend a little bit more time with them. I do have a granddaughter who just got her BSN and became a licensed nurse, an RN, and so I'm really looking forward to interacting with, continuing to interact and support her as she goes through her career. Have a couple of other grandchildren in college, so now that we're finally able to meet in person again, I am looking forward to being able to spend more time in that arena as well.
Excellent, excellent. We're looking forward to you having a good time doing that. But one final question. So with everything that has been happening in the past 2 years with COVID and everyone reflecting on their lives, what's one thing that you have taken away from your experience with COVID? I know that you've never stopped going full speed, but just looking back really quickly, what's one thing that you take away?
That's a really interesting question. I think that it has given us all the chance to reflect, right? Mm-hmm. Because we spent more time with ourselves than we were used to spending with ourselves. I think this society has really puts a prize on activity and being active all the time, and really does not put enough importance on taking time to self-reflect. Mm-hmm. And as we talk about a lot in social work, taking time for self-care. And I think that during the pandemic, we saw that not having that time for self-care really was a problem and a mistake, and something that we really needed to do, and we really needed to take seriously. And I think I heard more people talk about self-care mm-hmm. during the pandemic than I'd heard in all the years, coming up to it. And so for not just for myself, but I think for many of us, we began to realize that self-care it's not an option. It is absolutely necessary, right? That old adage about you can't pour out of an empty cup, mm-hmm. or, talking about on the airplane, you've got to put your own oxygen mask on first, because if you're not taking care of yourself, you're not going to be able to take care of anyone else. And not just so you can take care of other people, but that you are important as an individual. And, I think as women, we often put ourselves on the back burner. We're like, well, I'll do that when I get done with this, and this. And I think the pandemic kind of forced us out of that mold a little bit. I think it's going to be interesting to watch whether or not we can retain that focus on self-care, because I really think it's important.
Absolutely. Famous last words. And may your cup runneth over. It's always a pleasure speaking with you. I wish I had your energy, and I appreciate you being in my circle. Thank you so much, Linda, for joining us for our session in Partnership Live. And I look forward to seeing you next time at Partnership Live. Thank you.